Hi, my name is Dr. Mark Conliff of Bodyworks Musculoskeletal Medicine in Louisville, Kentucky, and this is a presentation about knee pain, specifically osteoarthritis. This is a presentation that I've given a couple times in my office as a educational seminar. But we've had a few individuals that have contacted us for whatever reason are not able to make it into the office and are still interested in the information. So I wanted to record this and put this up online so that those individuals would be able to get the information as well. I will say that for those who are able to make it out to the office, we tend to offer some extra incentives because even making it out here, those individuals demonstrate a willingness and a motivation to work on healing their body. And so these tend to be individuals that we like to partner with in doing so. So they get some extra incentive by coming out. But as far as education, I want to present this for anybody who's willing to learn. So we'll get started. All right, so arthritis is the #1 cause of knee pain. Um, Characteristics that we typically see involve pain, swelling, limited motions of the joint. In some situations, there may be some catching or locking. Typically, this is indicative of some other things going on that may be partnering with the arthritis and causing pain. Now, today's goal is to learn a little bit about what osteoarthritis is in the knee, learn about what options there are to treat it, what treatments are out there currently available, what treatments are kind of new coming down the line, and what the differences are maybe between the current common medical practices versus what, in my opinion, we should see, and the type of treatments that you might see coming out of our unique office. So what is osteoarthritis? Well, osteoarthritis is wear and tear. Bottom line, if you get nothing else out of this lecture, wear and tear on the body is what creates osteoarthritis. Now, a lot of people tend to come in, they tend to think of osteoarthritis as something that they caught or something that has infected their joint, something that is growing, a disease that they've picked up, which that's not the case at all. It is wear and tear. If we all live to be 200 years old, we will have osteoarthritis in every single joint in our body. That's just the way it works. Like any other good piece of machinery or bad piece of machinery, the more that you use it, the more pressure that you exert on a mechanism, it will eventually wear down and wear out. And that is what happens to our body and what happens to the joints in our body. Osteoarthritis is the most common form of arthritis. That's why most people over 50 have it, because that's 50 years of wear and tear that we're putting on our joints. Knees are most commonly affected. Why the knee? Well, again, we've been walking around since you were roughly about 1 year old, and that is constant, consistent pressure on the joint. Things that may contribute to it are previous injury, increased age, obesity, deformity. Some of these things where we're putting more pressure on the joint can speed it. But even somebody who is being very nice to their joints and doesn't have any of these things named here, ultimately the arthritis will set in because the joint will eventually wear out. And the knees just take the brunt of most of them. So here's a picture of a knee joint. On the left you see a healthy joint, good thick layers of cartilage. This doesn't really depict much of a meniscus, but there's a meniscus that forms a buffer in there. On the right you see some of the changes involved with arthritis. You see some wearing in of the lower part of the leg. You see some wearing away of the cartilage here. Some of these red spots, these kind of pock marks that you see in there, are wearing away of the cartilage. There is some bony changes along the edges. Here you can see them on the side. That's what we refer to as bone spurs. Those are mostly indicative of an instability in the joint. But what you're also seeing here is you're seeing an angulation change, where a lot of the pressure in this individual's knee is now on the inside of the joint, whereas the outside of the joint is not getting nearly as much. Person's center of gravity is shifted inward, and now they're putting all that force here and getting a lot more wear and tear on one side of the joint than the other. So this is a picture of just a generic healthy joint. You see two bones, cartilage overriding the bone where they meet together, a joint capsule, so this along through here and through here form a capsule which holds synovial fluid inside. That synovial fluid provides cushioning and lubrication for the joint. And then there is further soft tissue involvement, muscles, tendons, ligaments outside the joint, which further work for stability of the joint and the integrity of the joint. Now again, as we put wear and tear on it, it eventually starts to give, and you start to see these types of changes. Bone spurring, as we saw in the previous slide, little pieces of the cartilage or bone breaking loose. We call this loose bodies within the joint. And some of those you may see on x-ray or have been referred to in your own joint. A lot of times these little pieces come off. They kind of form a little bit of a pearl type subsistency and get pushed off to a pocket in the joint. Normally don't cause problems, but they can. These can be some of the things that cause that locking or sticking inside the joint. So here specifically, again, there's some of the more arthritic changes of the knee. Again, we're seeing exposed bone as part of the cartilage wearing away. We're seeing the bone spurring, and also, an extra point to be made is you see an eroding of the meniscus. The meniscus, better seen here than the other slide we had, is an extra buffering layer because the knees take so much pressure. This is a pillow. This is a buffer in between the two cartilage portions of the joint, which provides an extra layer of protection. Now again, as we have wear and tear on the joint, the meniscus eventually starts to tear and starts to deteriorate and go away. So people get very caught up about having a tear in the meniscus and things like this. When there is significant arthritis going on in the joint, that is just part of it. I don't know that I've seen a MRI with a moderate to severe arthritis in it that hasn't had at least some degree of meniscal tearing or meniscus wearing away. And severe arthritis, very often they're just obliterated and pretty much gone. Okay, so here's a couple x-rays. These are the things that we're looking at because we can't look inside your knee like the drawings previously, so this is what we get to see. These are a couple of x-rays of good knees. This one is straight on through. This one is coming in from the side. But when we start to see arthritis setting in, again, these knees still look pretty good, but we're starting to see a little bit of joint space loss on this individual on the inside, which would be considered a early osteoarthritis or a grade 1. In a grade 2, we're seeing a little bit more joint space loss. We're seeing some destruction of the tibial spines here, bone spurring on the side, and again, further loss of joint space. And then further advanced arthritis, we're starting to see, here's a grade 3, significant loss of joint space. You're seeing a shifting of the entire thing. Sclerotic changes, you're seeing actual changes of the bone here as they're getting hitting together and getting pretty beat up. And again, more significant bone spurring on the side, and then in grade 4 where you're really seeing the joint being obliterated and fairly significant beat up in that situation.